Question of the day: what is an opportunistic infection? Hey everyone, it's the Wellness Doctor, Dr. Jeffrey Clark, and I've had a number of patients ask me that question over the past couple of days, so it must be in the news somewhere because I've had a number of folks talking about it recently. So let's just deal with what is an infection. An infection, in my definition, is going to be a non-synergistic microorganism that invades our system. It invades either a tissue or a system or an organ or the organism. And when I say non-synergistic, well, what is synergistic? We have our microbiome, all the bacteria that live in us and on us, and all the viruses that live on all the bacteria. Remember, 1% of your DNA is actually human. The other 99% comes from all the other bacteria and viruses, everything that's living in you and on you. 10% of the cells in your body are human. 90% of the cells come from the bacteria that make up your microorganism or your microbiome. That's what I would refer to as synergistic. So non-synergistic are ones that don't belong there. So these can be certainly bacteria, viruses, fungi like yeast, molds, things like that, protozoans. So how would that happen? So maybe you're down at a pond and it's kind of stagnant water and you drink some of that water. You might get some protozoans in there into your system that your body really doesn't want. If I'm working and I'm cutting my vegetables up, I got my Cutco knives and I cut through my thumb and it starts to become infected, becomes red and painful. Obviously the red might be blood, but after the fact, once it stopped bleeding, you get that red swelling. That's an infection. And that's an opportunistic infection because if I didn't cut my thumb, those bacteria wouldn't be invading there. So an opportunistic infection is an opportunity that doesn't normally exist that allows these microorganisms to take hold. So the terms that I think people are hearing in the news for opportunistic infections, they're dealing with our immune system. Our immune system is suppressed. Then it becomes more opportunistic for other diseases. When you look at HIV/AIDS, you have a suppressed immune system, then you succumb to other diseases, pneumonia, things of that nature is what they originally saw. Why are there all these cases of sarcosis pneumonia? I think that's what it was. But anyway, they were seeing these opportunistic infections. Well, now we're going to see that again, I predict quite a bit as this crisis of COVID-19 ebbs and flows and ebbs and flows. We're going to see it's under control, it's flaring up, it's under control, it's flaring up. And I think what we're seeing now is where people have been overprotective, their immune systems haven't been normally expressing themselves. They've been basically suppressing their immune system by staying home, not leaving, sterilizing everything, putting on lots of hand sanitizer, killing off their normal flora, their microbiota, damaging the protection on their skin, wearing masks indoors, outdoors, staying home with a mask on. People are doing that. There's just a lot of fear, wearing gloves, not touching anything. So our immune system is basically being suppressed, and then all of a sudden, hey, let's all go out at once, and we're exposed to things. It's like little kids. They're in preschool, they pick up everything. They go there, they come home, they have a runny nose, they're all snotty, and that would be basically an opportunistic infection affecting preschool children, and that's just they're building up their immune library. But here what we're seeing is people whose immune system haven't seen something, they've been not getting out. As they leave their homes, they're going to be possibly experiencing bacteria, viruses, other types of microorganisms that they haven't seen in a while, and their immune system kind of kicks into gear and they get sick. So don't be surprised if people, as they're leaving their homes after being shut in or locked in for weeks or months, experience these opportunistic infections. So that's what I think people are hearing about out and about, and that's what we're seeing. We've seen a spike, maybe 20 to 40 cases in the hospital, where one week there's 20 COVID cases, the next week there's 40, and many of those people who are in the new hospitalizations, up until a few weeks ago, they hadn't left their house for weeks and weeks. So that's what's happening. That's an opportunistic infection. It's an infection that wouldn't normally occur if not for a new opportunity, whether it's a cut on your finger, drinking stagnant water, or going out after you've been shut in your house for so long. So till next time, have a great day.